All right. Good afternoon, South Coast. Hope everyone's getting ready for the weekend. Here have a special guest. We're kind of doing a weekly update with the South Coast Health group to kind of get people update with what's going on with the vaccines and coronavirus and all that kind of stuff. So my special guest today is Dr. Carlos Correia. He's a primary care physician with South Coast. So thanks for coming on, Dr. Correia. Can you just tell people about yourself? You've been a doctor or in the healthcare for over 25 years, I believe.
Yes. Gladly. I've been working or practicing here in Fall River for basically 27 years almost, always with South Coast. And my specialty is family medicine, therefore primary care. So prevention of disease is extremely important. So obviously talking about COVID and preventing COVID is really something that we've been focusing on for the past year, unfortunately, because of the status of the situation of the pandemic. So I've been gladly talking about how to prevent it and what to do, obviously, in this particular situation.
Yeah, if you can give people kind of an update. I know, last summer we really ramped up and we had a second wave. And what's the status right now? How does it look like in the South Coast right now?
So on the South Coast, I think it mimics the national tendency, which is to a decrease in new cases, a decrease, obviously, in hospitalizations, a decrease in deaths. All of those numbers have been decreasing in the past several months, actually, mostly after Thanksgiving and Christmas. Those numbers have drastically decreased in the past month. And they have done so, especially, I think, because of vaccination. Vaccination was started occurring in December for the healthcare professionals. I got my first vaccine in December, the second one in January, and then on obviously is expanded to the point that everybody that is at least 12 years or older can get a vaccine, one of the 3 vaccines that are available in the United States. So that especially is what has really brought the numbers down. And up until then, we only had the social distancing, the masking, washing hands frequently, those the only weapons available to us to fight the virus. But fortunately, we came up, or different labs obviously came up with with several vaccines that are very, very effective. We're talking about 90 to 90% efficiency in preventing severe disease or death from COVID, from this virus that's really completely spread all over the world and has been done havoc all over the world. So definitely has the vaccine or vaccines that have proven its effectiveness. We're one of the countries that is more vaccinated. We're as a country, over 50% at least have gotten one vaccine, and over 30% have gotten completely vaccinated. But actually, if we look at the state of Massachusetts, we look and see that over 66% of the people have gotten at least one vaccine, and over 50% are fully vaccinated, which is wonderful numbers. Unfortunately, in the South Coast areas, Bristol County and so forth, we're a little behind the rest of the state. We're I think the second lowest county as far as vaccination rate is concerned. So we're in a state that has a very high vaccination rate, but unfortunately, the South Coast area is actually bringing the state down. So we really want to promote vaccination within our area, because we know that's really the only way that we're going to be able to continue to improve this situation, and not end up having another wave in the fall with an increase in cases, increase in deaths, because that might happen if we don't get enough people vaccinated to prevent this as we start opening up. And obviously, we can't keep our society closed forever. But vaccination has become really a huge weapon against this virus, and I encourage everyone to be able to use this weapon against the virus. As I usually say, and I got vaccinated, my wife got vaccinated, my sons got vaccinated, my siblings got vaccinated, my in-laws got vaccinated, my nieces got vaccinated. So everyone that I can convince to get vaccinated and has been vaccinated. And I think there's no more proof of the trust that I have in the vaccine than exactly the fact that all of my family has been vaccinated. So I really encourage people to get vaccinated as soon as possible.
Yeah, New Bedford was like one of the last communities to be in the red. The Massachusetts did this red, yellow, green kind of status on the areas. And from my understand, like people, the elderly are about 90%, but it's the youth maybe that are having a little problem getting those vaccinated. Is that kind of true, where it's the younger crowd? And also because we started with the elderly and now we're down to the youth, is that it's just the youth that are just not getting vaccinated, or?
It is. I think the youth, for several reasons. I think the youth certainly are at lower risk of getting severe COVID disease. That does not mean that they can't. And we do see nowadays in the hospital, because we've started vaccinating more of the older people, that we see more people coming into the hospital, younger people with COVID. So it's hitting more of the younger people because the older people are more vaccinated. So I think there is some resistance. Obviously, they were also the last group to be eligible to get vaccinated. But there is some resistance in thinking that they will be able to fight it off. But when we get vaccinated, I think we're not only protecting ourselves, we're protecting everybody we come in contact with. We're protecting our family, our friends, our coworkers, and we're also protecting society, because there's something called herd immunity, which is that we need a certain percentage of the population to really be immune. Therefore, in this case, either get the disease and get some immunity, or get the vaccine and therefore have that herd immunity, so we can really limit where this virus can go to, because the virus needs us. The virus is transmitted from person to person, and if you're vaccinated, you break that transmission. And that's what we need to do, because we also have to be worried about variants, and variants are just mutated virus that can occur, and more likely to occur the more people that are infected. So we see this now coming up from India and Brazil, places where the incidence is much higher, where there's many more infections. And not only do we want to, protect ourselves against this virus, but we want to also avoid a variant coming along later on that might have more resistance towards the vaccine. So it's really important to start with our communities, vaccinate as much as possible, then spread out into the rest of the world to really be able to really protect against this virus and this menace.
Yeah, if you have a question for the doctor, throw it in there and I'll throw it up. So Aaron asked, if you've had COVID, you really need the vaccine. I've seen studies now saying antibodies lasting longer than they expected. So there's still people who have had it in the past are still recommended to get the shots, right?
The recommendation is still the same. We do believe that at least for 3 months, they probably have enough immunity. It starts to wane after that. They might have it from 3 to 6 months, some immunity, but the vaccine gives you much more immunity than the actual disease does. So it's still advisable. You can wait, a month, a couple of months. I would not wait more than 3 months. I would still recommend getting the vaccine. And again, there's 3 choices. You can get the one-shot Johnson & Johnson, or the Moderna and the Pfizer. And nowadays, you basically can pick which vaccine you get. Whereas in the beginning, when I went to get my vaccine, I found out which one it was when I got there, because it was whatever was available. But now there's a lot more availability, so you can actually even pick your vaccine. But I would say yes, still you need to get vaccinated. You do have time if you've got COVID, so you do have some immunity, but you still do need to get vaccinated to make sure you get that higher immunity for against the virus.
Yeah, I think you bring an important point. I covered all of Baker's press conferences, and he gives us updates. And he said it really was, the vaccine is a race against mutation. You got to get everyone. If you can stamp this thing out, you stop it from being, mutating, like we've seen, like you said, overseas. And that's pretty important, right?
Extremely important. As I said, and that also shows that it's not just important in our community and in our country, but it's actually important to get this vaccine out then throughout the world, because a variant arises in some other part of the world where they do not have access to vaccination, and it can easily spread throughout the rest, even to our country. As we know nowadays, this virus spread very quickly across the whole planet, basically. And nowadays, with the communication, with the flights and so forth, a virus is easily transmitted from country to country. So we do want to stop the variants, and the vaccine is really the only way to do it. And obviously, they're also working on and studying the variants to make sure that if we need boosters later on, that they might offer a little bit more immunity towards the variants that we already know. But we never know the unknown, and any variant can pop up at any time. The more virus replicates, the more infections, the more likelihood of a variant being more immune to our or having greater immunity, greater resistance to our vaccines. So yes, it's still a race, and will continue to be a race. We're not going to get rid of the virus. We just need to control it so that we control it and it doesn't control us.
Yeah, the biggest thing I've seen, and I think it's a valid kind of concern when you don't really get the information, is vaccine safety. So this vaccine, I tell people, like, this kind of like the mission to the moon. All these countries put all their resources behind it, so we got it very fast. And it did have some significant trials. It wasn't just like a dozen people they trialed. I've seen some as in the tens of thousands. So kind of alleviate the safety concerns people might have out there for this specific vaccine.
Right. For these vaccines went through the same trials that they usually go in other circumstances. Obviously, I think I would say that a lot of the red tape was erased. I mean, we know how bureaucracy works. It always takes a long time for licenses, for this and for that. Well, they cut all of that red tape out because we needed the vaccine as soon as possible. So I think that's one of the reasons why it came out. And also we put a lot of effort into it. A lot of resources were put into it. So it wasn't sort of the studies that they usually do, but they limit how many resources they put into it because something might come out of it or not. A lot of resources were put into this. Therefore, we were able to get it faster. But it went through the same trials. It proved to be efficacious. It proved to be safe. And obviously, there is always, there was the Johnson & Johnson's, a few cases, I believe 6 cases, 1 person that died, so with 1 complication. But that's extremely, extremely rare. They are very, very safe. I always say, we go out and drive every day. We could get into an accident, right? But we take that risk because the risk is small if we're careful. There's risk with everything that we do in life. And so there's obviously an extremely small risk with this vaccine. It is extremely safe, as there are risks with anything that we do, with any pill that we take, with anything that we do in life. But it's extremely safe. And like I said, I don't think I can really project how secure I am in that, more so than saying that, me and my family all got a vaccine. So, and we all got different ones depending on which one, was available at the time. But I am very, very, I feel really, really sure that the vaccines are very safe, and they've proven that. And so I think, that, if you look at the risk of getting COVID and dying from COVID, it is so much, much higher than any possibility of any side effect from the vaccine, permanent side effect from the vaccine. So please do get a vaccine as soon as you can.
Yeah, and Stephanie brings up a point, and I've heard this a lot too, is if you get vaccinated and you end up, the one of the benefits of getting the shot is if you do get COVID, the symptoms are a lot less severe, right? Does that make sense?
Correct. So vaccine no vaccine is 100%. When we talk about these vaccines being about 90 to 95%, that's extremely good. Most vaccines are probably approved if they show a 50% efficacy. So these vaccines are extremely efficacious, but of course, it's not 100%. You can still get the disease. You can still get the virus. So if you come in contact with somebody that has a virus, so the virus, you can cough the virus on you, you can breathe the virus on you, but typically, if you have the immunity, you probably will not get any symptoms, and you probably will not pass that virus to somebody else. But you might get a few symptoms. You might get some mild symptoms, typically, and that will be it. In most cases, that's it. So again, he can pass the virus on to you. You just have the defenses to right away attack that virus and kill that virus and not let it infect you more, and therefore spread that virus to other people also. So that's how a vaccine works. It just basically prepares your body to fight off that enemy, which in this case is the virus.
Yeah, and so I want people, obviously we're talking about the shots. So tomorrow, I'm gonna pull this flyer up. So tomorrow, the health van, the Southcoast Community Health Van, is going to be right near the Madeira Feast Grounds from 9 a.m. to 2 p.m. If you put in your GPS 88 Tinkham Street, you'll get to the entrance of the Feast Fairgrounds. It's free, it's fast, it's safe. You can go in there. You don't have to make an appointment. Just show up. You get your shot. This is the Johnson & Johnson shot, I believe, which is a 1 shot. You don't need 2. So it's important. And the point to bring up is we've lost the Portuguese feast for 2 years now. And if we don't, if it does resurface and we go through another year of this, you lose another one. That's one of for people that want Madeira wine and good music and all that kind of stuff that we have, this is one reason to do it. And the folks at the Madeira Club, the Portuguese Channel, the Friendly Sons of St. Patrick, United Way, everyone is really getting together, get the word out. We're doing it as well. So that the community van, just tell people about that. It's a nice thing. It's kind of like a mobile van, and you can have some nurses there to provide the shot, right?
Right, and I think it's really a good place to have it. It just shows you exactly the feast that has not been able to occur because of the virus. And actually, at that same place, you'll be able to get a vaccine. In this case, Johnson & Johnson, which is just once, so that in the future we might be able to again have this feast. So where a lot of people get together, and I've been to that feast, which is excellent. So. I do encourage everyone, again, no appointment. What else do you need? You just show up and get one shot and you're done. So, I mean, we can't make it any easier than that. I mean, there's been all across the country a lot of things that are being done to try really to encourage people to get the vaccine. And again, I usually say, it's your civic duty to get the vaccine for your society, for your neighborhood, for your friends. It's a civic duty, I think. And the way I look at it.
Yeah, I look at it another way is like last year it was a lot of pain. We were all sitting inside. We were forced to ration. We had water, toilet paper, issues around the country. And if we let this thing mutate and come back and our current vaccine becomes ineffective and we start all over again, it becomes, if we don't hit that herd immunity and get past this, we're going to be stuck in this again. We could end up being a year after year event. So I've got my shot. I got the Moderna. I got both shots. The second one hit me a little bit harder than the first one, and it was just primarily I felt like it was the last day of a mild flu, and it was a little bit of fatigue and a little bit of sleeping, a little bit of softness and soreness on the arm. But I got the shot. I'm fine now, and I'm hopefully that 95% or so is what they say effectiveness. So. I really appreciate your time, Doctor, and we like having the South Coast group on because you guys are the experts. I think most people respect you guys because what I say every time when I interview some of the professionals there is you guys had to work without the vaccine when it first came out, around people and saving lives. Then you were the first ones to actually get the vaccines to kind of prove to people that, hey, this is something that we're stepping up to do, right?
Exactly, sort of the guinea pigs. And I must say I had the Moderna vaccine myself, and I had pretty much the same symptoms you just described that occurred to you. And I just also wanted to mention to people, so the side effects from the vaccine occur because the vaccine basically tricks your body into thinking that you're getting infected. And so it reacts to build antibodies and all the T cells that are necessary, the reason why you get the vaccine. But for about 24 to 48 hours, it thinks you're getting the COVID, and it acts like you are getting the COVID infection. But when it realizes this is a false alarm, then the symptoms go away, and you basically now are developing your immunity. So that's why you get those symptoms from a vaccine. Any vaccine can give you sort of symptoms. Sometimes people get symptoms from the flu shot. So that's why you're getting those symptoms. It's not unusual. They usually go away 24 to 48 hours. Some people also get some nausea, some headache, depending on the shots. And typically the second one tends to be worse than the first one. That's what I've heard for most experiences. Now, Johnson & Johnson is just one shot, so it doesn't mean that you're going to get less symptoms. I think you might get the symptoms from that one shot. But again, 24 to 48 hours, they go away. It's nothing that we can't live with. And again, then you develop that immunity towards the virus, which is the ultimate goal.
All right. Really appreciate your time, Dr. Carlos Correia. Thanks, everyone, for tuning in. Share this video. Let people know. If you have questions, I always say is just call your own doctor. If you want to, get your second opinion. Your doctor knows, you better than anyone. If you have allergies, those kind of things. So talk to your doctor. This is just for general information purposes. So thanks again for your time, Doctor.
My pleasure.
All right, guys. Have a great weekend, everyone.